Hey folks, Scott Raffa here again. We're going to talk about another topic, which is spinal. It's a big one. Spinal reconstruction, reconstructive spine surgery. It's almost a generalizable term that says something that very large has to be rebuilt or again constructed in the spine. So I'd say, what's the best way to express and educate and talk about what that actually means for certain people that actually need that type of surgery? A big spine reconstructive surgery, a deformity surgery, kind of the same generalizable terms that mean similar stuff. So it really boils down to very small surgeries versus very large surgeries. Small surgeries are probably best described as localized, specific things that get treated through surgery to specifically treat a problem. A certain leg that's painful in a very specific place down to a certain toe, believe it or not. And so on. So, or even some weakness in the foot or the ankle, let alone somewhere else in the leg or the hands, and so on. So that's a really specific kind of localized problem. It gets treated with a certain plan based on the anatomy at certain areas of the spine. Okay, the other half of the equation is spinal reconstruction or deformity surgery. We could talk for hours. We probably should do more. I think we'll talk more about that probably as far as topics of discussion. We'll bring in our peds orthopedic folks. They do wonderful work, beautiful work on congenital diseases of the kids and adults, dysplasias, skeletal dysplasias, and so on. As far as the generalizable term, it means that the spine has had an alignment problem. It's not shaped the way it should. It's collapsed onto itself. It's compressed. It's even disarticulated, God forbid. It's too lax, and so on. So, how does that translate to a day-to-day? Well, a lot of people are suffering. They have tons of pain. They can't walk. They can't stand upright, and symptoms are multifactorial based on what's going on. So, when you deal with those symptoms, you have to really address the spine head to toe. People have spent entire careers just looking at the alignment of the spine. We have our metrics that are in normative ranges to try to get that spine in the best alignment as you can with all of our tools at our disposal, all the approaches to come into the spine and really address it in certain ways and shapes to get a great result. But that means you're really addressing the spine from head to toe. Those are larger surgeries. They last probably on the scale of 4, 5, 6 hours or more. Sometimes there's more than one surgery that's staged in order to get the best result. And oftentimes, honestly, we have more than one doctor that's there. We have all board certified surgeons here. There's probably about 2 or 3 surgeons, spine surgeons, that take care of those types of people. Myself as a neurosurgeon, peds orthopedic surgeons, sometimes vascular surgeons. So they're all helping out to treat this one patient. It's the most attention that you could get for the probably the greatest, most life-changing result. Nearly a miracle, I'd say, as far as what we've seen. People can have completely re-engineered their lives. They're walking, talking, they're a part of society, and they really have treated the whole spine head to toe and realigned everything and so on. So that's really what, to me, I think a reconstructive surgery means, or a deformity surgery, more academically stated. But you're really trying to really help this patient by realigning and addressing the whole spine, thinking very long term, thinking a lifelong of success, or nearly a lifelong of symptom relief, and so on. So those are actually near and dear to our hearts. They're near miracles. You see people walking and talking, and you'll never forget that story. So small surgeries, lesional things, specific things, level by level things, very small surgeries, and then very large surgeries. That's, to me, what I think a spinal reconstruction means.